Chinese President Xi Jinping has called for the swift containment of the COVID-19 pandemic and says the country will stick with its zero COVID strategy. Meanwhile, China's Jilin province will use rapid antigen tests in its mass testing campaign. The announcement comes as infections spread rampantly in China's new COVID-19 epicenter. Officials in Jilin will roll out the tests in schools and test 20% of students every day. China only made rapid antigen tests available to the public last Friday. It had previously relied solely on nucleic acid tests. Jilin has also started its 11th round of mass testing. Over 1,000 new infections were reported in the province today. Well, that's almost half of China's new COVID-19 cases. Hello, Min Min joins us live now from Shanghai. Min Min, schools still shut in Shanghai. How are the residents coping, and any of the frustrations that we are seeing in Hong Kong?
Yes, there is a lot of fear and anxiety here in Shanghai. People are worried, not knowing when they could be the next one to be put into a 48-hour lockdown or even a 2-week one if there is a positive case detected in their building. A few days ago, there had been rumors flying around that Shanghai could go into a citywide lockdown, but the authorities have repeatedly refuted that, saying that it is fake information, that Shanghai will not go into a citywide lockdown, but instead, what the government is doing is to divide the city into grids and taking turns putting these grids into 48-hour closed-loop management, during which they would conduct mass testing twice. If everyone is tested negative, they can exit that loop. Otherwise, it goes on for 2 weeks. Now, people are complaining about what they see as a lockdown, even though the government doesn't want to use that word, preferring to call it closed-loop management. And people are saying that these 48-hour lockdowns are extending into 72 or even 96 hours because they are not getting their negative test results in time. And that's because the system is overwhelmed. Yesterday, the online portal for us to access our test results crashed for several hours because of the sheer number of people doing the tests at the same time. State health authorities on Tuesday acknowledged that they need to beef up testing capacity by purchasing new equipment and training new personnel. And here in Shanghai, the streets are so quiet, people afraid to go out after the government banned people from traveling unnecessarily. And there is a feeling that Shanghai is more isolated than ever, as the government announced that they would divert over 100 flights away from Shanghai starting from March 21st in order to free up, to reduce the pressure on quarantine facilities in Shanghai.
I mean, this whole zero COVID strategy, the Chinese officials are still insisting on it, even as the numbers ease. But how feasible is it now?
Well, the Omicron variant is certainly putting China's dynamic zero COVID policy to the test. Medical resources are stretched. As you know, in Jilin, the government has been racing to build 8 makeshift hospitals totaling over 10,000 beds, as well as hundreds of new quarantine pods to house these close contacts of COVID-19 patients. And today they have rolled out those antigen test kits, distributing it to schools and universities to supplement the nucleic acid test system. And this is quite a fast implementation of a new COVID-19 playbook that was released just on Tuesday night. The government saying that with the Omicron variant spreading faster than ever before, they need a new mechanism to detect cases early. And that's why they have rolled out these 12, they have approved 12 antigen test kits that can be purchased off the shelves for people to test themselves at home. And a top infectious disease expert in Shanghai has laid out 6 preconditions for China to move away from zero COVID. And that includes, for example, vaccinating the elderly, because even though China has vaccinated nearly 90% of the population, if you look at those above 60, the vaccination rate drops to only about 40% because many elderly are worried about side effects for those with underlying conditions. He talked about the need for better vaccination, and here he is referring to the mRNA vaccine that China is still trying to develop. He also talked about the the need for differentiated treatment according to severity. And now there is a new measure that would allow people with mild or no symptoms to be quarantined in centralized facilities instead of being hospitalized. And this is quite significant because most cases here have mild or no symptoms. In fact, that applies to 95% of the cases in Jilin. So if this new measure is put in place, it would free up more than half of those beds that are occupied by COVID-19 patients in hospitals. So there is a roadmap for China to get to a place where they can coexist with the virus. But how soon that could happen still remains to be seen.
All right, many thanks for those updates, Lo Min in Shanghai.